Thank you for joining us today. I'm Carly Putnam, and I serve as the Policy Director and Healthcare Policy Analyst with Oklahoma Policy Institute. As part of our celebration of the 55th anniversary of Medicaid, OK Policy will be holding a day-long series of virtual events focused on this important program. Sooner Care, Oklahoma's Medicaid program, ensures health care for hundreds of thousands of Oklahomans. It's an absolutely vital part of our state's healthcare landscape. Our first event of the day is this morning's discussion about the importance of Medicaid in Oklahoma and what our state can expect following the recent passage of State Question 802, which calls for expanding Medicaid in the state for low-income working age adults. Joining us today for our discussion will be Representative Emily Virgin of Norman, who represents House District 44 and serves as the Democratic Minority Leader in the Oklahoma House of Representatives. And also joining us will be Representative Marcus McEntire of Duncan, who represents District 50. Good morning, and thank you for joining us. For our discussion today, I've got a few questions that I'll pose to each of you, and then you'll have the opportunity to answer in turn. And Representative McEntire, we'll kick it off with you. Going into a tough budget year, funding for Medicaid expansion will likely be contentious. What are your thoughts on that?
Well, you're right. They are going to be contentious, and it'll be as contentious as we make it. Last year with Sooner Care 2.0, we figured out funding mechanisms for Medicaid expansion. We were doing it with Sooner Care 2.0, which was precisely the same thing that 802 has done, although in expanding Medicaid, although 2.0 was statutory and not constitutional, but same price. Same concept, same state plan amendment, all of that. So we figured out a way to fund it last year. A large portion of it fell on the hospitals through SHOP, the Supplemental Hospital Offset Payment Program. There were repurposing of funds from mental health because right now we're funding a lot of uninsured folks' mental health at 100% state dollars. And with Medicaid expansion, we're going to be able to do those for a dime on the dollar. So that frees up some money and maybe some repurposes. We can repurpose it. It will definitely lower the appropriation. So we looked at a number of different funding scenarios. We had it done. We sent the bill to the governor, and of course, as everyone knows, it was vetoed. So, I mean, we can make this as hard as we want to be, but we don't have to make it hard. We've already got the roadmap there to fund Medicaid expansion. Hopefully, we will fall back on the work we've already done instead of trying to reinvent the wheel. It will be contentious, especially when a third-party MCO, managed care organization model, is put into place. The governor has asked for a request for proposal from managed care organizations. The hospitals will have, our local rural and urban hospitals will have a problem with that, since they're forking over much of the money that will help pay for Medicaid expansion. So that part will really be contentious. I don't expect the budgeting to be as contentious as the managed care.
Thank you, Representative McEntire. It'll be as contentious as we make it is a really great way of putting it. Representative Virgin, what are your thoughts on funding Medicaid expansion going into a tough budget year?
Yeah, I think everything that Representative McEntire said, I would agree with. That doesn't happen a ton in the legislature, but Marcus and I have found some ways to work together, and I appreciate that. I think it is important to note that there was a funding plan on the table for Medicaid expansion in the last legislative session that the governor decided to veto. And so a lot of what you heard in the campaign against State Question 802 was that we would have to raise taxes, or that there would have to be budget cuts to other core services like education. And that simply isn't true. There are other ways that we can fund this. And that probably inevitably involves the SHOP fee that Representative McEntire spoke of. For, I think, the existence of the idea of Medicaid expansion, the hospitals have been willing to fund a portion of it with the SHOP fee. And so I expect that to definitely be a part of it in this first year, when we haven't realized savings, it will be more challenging and we will see a higher price tag. But I think that there are some temporary stopgap measures that we can use for the first year, and then we'll be able to realize those savings down the road, and the state portion will be much smaller as we begin to realize those savings that Representative McEntire spoke about. This will, of course, be a year that's tough for core services. I think that it gives us an opportunity to look at all of our revenue streams, to look at how we fund government, to take a holistic view of that. Our cities right now are suffering because of their heavy reliance on the sales tax. And so that's something that I'm hoping that we'll take a look at, that this, again, it when life gives you lemons, make lemonade, maybe, that we have an opportunity now to try to decide whether our revenue structure really suits us as a state and whether it's working for us.
Thank you so much. And as long as I've got you here, we'll throw to you for the next question. And Representative McEntire started to touch on this a bit. And now that Medicaid expansion has passed, we have to implement it. And can you describe what the legislature's role will be in that process?
Right. So the funding mechanism, again, will be the most important part. And so that will be, I think, task number one for us. But then we also have to figure out rules and regulations that implement this program. And so Marcus has done a lot of work on this already. We've talked about a lot of different options, whether it is the implementation of managed care, whether it's the implementation of other limitations on the program. I will be pushing for as expansive of a program as we can possibly get, because I think that when we have more people insured, it's better for us as a state. It's better for people who already have insurance, drives down costs for everyone else, and we will all be able to see the benefits of having more people insured. But I think that there will be a conversation about managed care. I think that Marcus and I are in agreement that we absolutely would not want a third-party for-profit company to come in and do any type of managed care program. I wouldn't want another profit motivator coming in to benefit from this program. We need all of those dollars, as many as we can, to go to expanding healthcare coverage and not to higher administrative fees. If we were to look at a managed care program within the healthcare authority, I think that's something that we can talk about. But then there are other provisions that focus on work requirements or drug testing, lots of different things that other states have done. Co-pays are an option as well. Most of those, like drug testing and work requirements, haven't really shown to improve the programs. There are a couple of models that involve co-pays, and I think that that'll be something that we look at. But it's important to note that because this is a constitutional amendment, that we wouldn't be able to put any requirements on this population that we don't put on the Medicaid population as a whole. And so we would have to be looking at the entire program, not just the expansion population.
Great, thank you. And I'm glad you brought up the managed care piece. I know that's sort of the second tier level of healthcare policy, and it's going to be where a lot of the where the debate happens going into the next year. So speaking of which, let's bring Representative McEntire back to talk a little bit more about what that implementation process might look like.
Yeah, Emily's right. I think our main role in this whole thing is going to be the purse. We hold the purse strings, so we'll be funding the expansion, and let's be clear that we have a constitutional obligation to fund Medicaid expansion now and balance the budget at the same time. And so we will have to fund it. Now, you know, you guys, we're already starting to talk about managed care, because that's going to be the hot button issue. Last year, we came up with a plan for an in-state managed care option that everybody was on board with, but that died with the governor's veto pen when he vetoed our funding bill. But we had agreements with the hospitals, with the governor's office, and pretty much everyone else involved that we could do an in-house managed care. But it looks like with the governor putting out an RFP for more traditional third-party MCOs to come into the state and bid, that he is now back on the third-party managed care. I have problems with it. My main problem is we're going to end up, after it's all said and done, being matched over $1 billion from the federal government. And most managed care organizations, their fee is going to be between 10 and 15%, just their admin fee. And just think about 10% of over $1 billion that we'll be just sending out of state that we could actually use here in state to set up a program that we tailor ourselves. I mean, I'm not a Pollyanna about this. I know that we're going to have help as we're setting up within the state. If we go that route, if we set up our own managed care program within the healthcare authority, we will need help from and wisdom and best practices from some of those MCOs. But and I'm fine paying for that intelligence or whatever. But I just see, going to a third party managed care company will be problematic, especially when we're spending $100 million to $150 million just in admin fees to that company or those companies. Leader Virgin, she brought up, the idea of copays and premiums. You talk to any health professional out there, and they will say when people have skin in the game and they're paying a little premium, and I'm not talking about a lot of money. I'm talking about 2% of however much money they make, but something really small in premium, just to give them some ownership, give people ownership of their health program. And so I think that's important. Medical experts will tell you that literacy and compliance both increase when people have a vested interest in their healthcare. And so that would be the only way that I would, push premiums. But that really, it seems like that the governor's office is mainly calling all the shots here, and it's going to be up to us in the legislature to decide to fund it or not.
Yeah, that checks out. Thank you. So to move on to a somewhat more optimistic topic, what do you think is the greatest opportunity that passing Medicaid expansion brings to Oklahoma, Representative?
Oh my gosh, it's going to really help. It will help rural hospitals. I mean, right now, if you look at healthcare is the only business that I know of in the United States where the government says that you have to provide care free of service. So they want you to provide a service for free. It's one of the only industries I know. So Medicaid expansion is going to help rural Oklahoma tremendously, because you have a disproportionate share of Medicaid clients who live in rural areas. And right now, the hospitals are providing a lot of ER care free of charge to folks who are uninsured. And the hospitals, even though they lose money on every Medicaid patient that they serve, they still will be getting something now that they've never gotten before in terms of revenue. And then when you add the SHOP benefit to the back end of that, and for those of you that don't know much about SHOP, it's the Supplemental Hospital Offset Payment Program. Basically, that SHOP is meant to bolster the Medicaid payments to get them to Medicare payments, which is the upper payment limit, so hospitals don't lose as much money on Medicaid patients. And so that even brings up another ball of wax that's going to be arising that we're going to have to deal with. And how do we retool SHOP for an expanded population? But it's going to help rural Oklahoma. It'll help urban hospitals too.
Yeah, definitely. Yeah, and I think it's funny, we talk about how the extent to which hospitals do have to provide care for people who show up and need it. But as I think anyone who spent any time in an ER waiting room knows, it's definitely not the optimal place to be actually getting healthcare. Let's flip to Representative Virgin, and I will throw her the same question. What's the greatest opportunity that you think passing Medicaid expansion creates for Oklahoma?
Yeah, I think aside from the obvious financial benefits that we will see as a state and as a population, I think it's going to be a really great opportunity for Oklahomans who have been in this coverage gap to have a primary care doctor and to use that primary care doctor to lead them in their healthcare journey instead of having to rely on urgent care or going to the emergency room. I think that when people have a doctor who can see them a few times a year, who can really be holistic about their care, that we will all see better outcomes and those people will see better health outcomes. And so I'm really excited about the opportunity for a lot of Oklahomans who haven't previously had the access to a primary care doctor who can look at the whole person and come up with a care plan for them, that they'll now have that opportunity, which can also include mental health care. That's something that people have not had access to for a long time. It certainly won't be perfect now, and Medicaid expansion is not the panacea for every healthcare issue that we have. There's still work to do, but I'm excited about the opportunities that the expansion population will have.
Yeah. Thank you for that answer. And so then building on that, with Medicaid expansion now, nothing close to a done deal, but closer than it's ever been before. What are other opportunities do you think we have now to support the health and well-being of low-income Oklahomans?
Yeah, I think that looking at a few things will really help us. Number one, thinking about how the expansion population can best use this program. And what Marcus was talking about with copays or premiums, healthcare literacy, and a stake in healthcare, I think that those are important topics for us to talk about. I think that also, as I mentioned, that access to mental health care and substance abuse services is something that we need to take a big look at, not just for the Medicaid expansion population, but for the population as a whole, because we know that mental health issues can lead to many physical health issues as well. And so that's something that we have had quite a gap in for some time as a state and really as a country as well. And so I think that is where we should look next. And that interfaces with a lot of other issues, whether it's criminal justice reform or education. And so having that access to mental health care and substance abuse treatment services, I think will improve our indicators and our outcomes in a lot of different areas.
Yeah, absolutely. One of the things that I'm going to be most curious to keep an eye on through implementation is going to be the way Medicaid expansion intersects with Oklahoma's criminal justice issues, given the number of people who we know wind up in prison mostly because they're sick and need health care.
Right.
So we'll throw then to Representative McEntire, asking the same question. What are the other opportunities for us now to support the health and well-being of low-income Oklahomans?
Right. I think mental health is going to, hopefully, there's a potential for our mental health system to just be revolutionized by Medicaid expansion. I mean, like I said earlier, that we're doing a lot of that right now with 100% state dollars, and we're going to be able to do it for a dime for every dollar. Not only will that, spin off some savings that are being spent there now, and where we can reallocate those funds, I would rather we reinvest those funds back into mental health. Everybody knows where the state of Oklahoma ranks in mental health. We've got to make some changes there with just across the board on mental health. And I think that there's going to be extra money there. I know that there will be extra money there to help that. And obviously just the impact on the people who will be part of the expansion population. It will give them certainty. It'll give them a little bit more financial security, because any health thing could, they could have creditors calling them. It's just a bad thing when they cannot pay for health care. So they're going to have some certainty and some coverage. I think that Medicaid expansion is going to really strengthen our safety net. And as a Republican, as an old school Republican that I am, I believe in a very strong safety net. Now, as a Republican, I don't like people to malinger there, but I think that this will just solidify our safety net. Also, preventative medicine is going to be huge. it will impact the lives. Hopefully people will be in a relationship with a primary care physician, so they're getting preventative care instead of going into an ER when they're impossibly sick at that time. Not only is the cost outrageous, but also just the toll it takes on their lives. So having some preventative primary care medicine in their lives is really going to be a positive for them. I'm super excited about that. Another important thing where we can access, that we can use the Medicaid expansion money for is housing. So we could really take on homelessness a little bit, food security, and that transition from people when they have served their sentence and they're coming out of prison, where they can have a seamless transition into a primary care situation. So 30 days before release, fill out all the paperwork, get them on Medicaid. And as soon as they're let out of prison, they have a primary care relationship, and they're not going to face the economic pressure of health problems or health costs right when they're out. Hopefully reduce some recidivism.
Yeah, one of the pieces that was a statistic that bowled me over the first time I read it years ago, and it still does every time, was out of Ohio and Michigan, talking about how for people who had Medicaid, who got access through Medicaid expansion, who were not working, getting Medicaid made it easier for them to look for work. And for people who were working, it made it easier for them to keep their job, which it's common sense when you think it through. But it's really impressive to see what that can do. So we'll stick with you then as we're wrapping up for our last question. Medicaid expansion would not have passed without lots and lots of work from everyday Oklahomans from across the state. And if they want to stay active on Medicaid as a policy issue, what's the best way for them to be involved?
Well, first of all, it would be to be knowledgeable and read papers, read what's going on in state politics. Tune into OPI. OPI is always talking about what's going on in Medicaid. So this is a good place to know what's going on, and then get involved with some advocacy groups. And I mean, the main thing is just to pay attention and then let your voice be heard. And you can let your voice be heard by emailing, texting, calling your legislators and your House members and your senators. You can also send emails to the governor, whoever. It really is pretty much going to be, grassroots effort, just like the petition was done. And people are going to have to keep their ear to the ground to know what's going on. And so that's what I would do.
Awesome. Thank you. We very much appreciate the shout out. If folks are interested in getting involved in advocacy together with OK Policy, they can go to togetheroklahoma.org. And that's the end of my plug. Thank you, Representative. Let's go to Representative Virgin. So with Medicaid expansion having passed with lots of sustained work from grassroots groups, how can they best stay active on Medicaid as a policy issue?
Yeah, thankfully, this is an issue that has been around for a long time. And so a lot of people are very informed about Medicaid expansion as a whole. But now that we are going into the implementation phase, the funding and the potential to put a few other policy initiatives in place, I think that it's going to be really important for people to stay engaged. The constitutional provision will keep some of the things that I think people will be against out of the conversation, but this is the time when administrative rules can really come into play, and that is a fairly boring topic for a lot of people, but it is a very important thing in state and federal government because that's where a lot of policy gets made. And so the thing I think that I would recommend is to stay in touch with OPI and Together Oklahoma, because OPI always puts out alerts about requests for comment and public comment, public hearings that people can participate in. And I think that especially with something as complicated as Medicaid and healthcare in general, a lot of people are scared away from the public comment and request for public input. And so what I would say is just stay engaged in that process. Don't be scared away by the complex nature of administrative rules, because again, that's where a lot of this implementation is going to be made. If the healthcare authority is going to request a waiver from the federal government to implement some sort of policy that is new to the state, they'll have to go through that administrative rules process and the waiver, the public input on the waiver as well. And so stay engaged with OPI and Together Oklahoma. And when there is an opportunity to submit a comment, I would encourage people to do that. I think that you would be surprised how few comments actually come in on a lot of things like this. And so your voice really can be heard. And of course, during the legislative session and before and after, make sure that you are staying in touch with your state rep and your state senator. I think that a lot of people see us as sort of far away and out of touch with folks, but that couldn't be further from the truth, especially now when we are all pretty much stuck at home. We are very much in tune with our communities, and we are watching things on a daily basis. And so reach out to your state senator and your state rep, and it doesn't have to necessarily be on a specific policy. I would recommend reaching out to your legislator, introducing yourself if you haven't already, and letting them know what your top issues are and what the values are that you believe in, and ask them to keep those in mind when they're making decisions about anything in terms of policy in Oklahoma.
I'm really, really glad you brought that up. And yes, absolutely. I think we expect legislators to be experts on so many facets of the public policy and the public policy process, and obviously you are. But the thing that I think
Right.
constituents need to hear again and again is that those constituents are experts in their own lives and how a lot of those issues will most affect them. So yeah, whether it's talking to a legislator or registering a public comment, just making sure that they're being heard from, I think is just so key. So thank you very much, both Representative Virgin and Representative McEntire. That wraps up our discussion for today. And once again, happy 55th birthday, Medicaid. As noted before, OK Policy is holding a day-long celebration of Medicaid in honor of that 55th anniversary. I encourage you to visit togetherok.org/protectmedicaid for today's schedule, as well as information and resources about using your voice to support Medicaid. Thank you again to Representative Virgin and Representative McEntire, and thank you all for watching.